Hey, so I returned back to New York today. I'm very excited to see my family. I miss them so much. Now, I wanted to create this post today to give you an update as to what the new medical plan is and also go over things you should ask before surgery. So, what's the new plan? I'm going to remain on my IV. Like, I actually have it hanging right here. If you could see it, it's hanging on a lamp because it has to be above my heart. So I'm going to continue with the IVs 4 times a day for the next 6 months, but we're going to add another antibiotic, which will be 3 times a week. For now, they're starting on a low dose, and if needed, they'll increase. They're starting on the low dose because it's a very toxic one, known to cause hearing loss and, not so good things happening in the organs and so on. So I will be on that. They're going to weekly check the toxicity level and make the determination of if it needs to be increased or not. I'll still remain on the oral. So that's pretty much the medicine part of it. They were going to actually stop the IV bags. They were going to stop that on the 15th because the doctor in New York wasn't sure if there was anything else that we could do, and perhaps we were going to have to keep me on the oral, just moving forward, because these are very heavy medications and they have long-term effects. So but the doctor here said no, I should still remain on this one, and we're going to introduce a second one that's through a pump instead of how this one has to be like gravity. This one will be through a pump, also through one of my lumens, so this shorter lumen probably. And after 4 to 6 months, we'll see how that's doing. If things have slowed down and things are getting better, they'll do an MRI in about 3 months. The other thing would be an interventional radiology, and what that is, it's a radiologist who goes in with the needle and the ultrasound and aspirates the fluid in the abscesses. So that's what I have to look forward to when I return. I'm not sure if that procedure hurts or not. I hope they numb the area, but I guess whatever I need to do. So now I wanted to go over some questions to ask surgeons before going into any surgery. It doesn't have to be like cosmetic, any surgery. Okay. So one of the things I want you to ask is, what is that doctor's rate for infection? Now, especially you could ask like non-tuberculosis or Mycobacteria infection. Ask about that. Okay. So what's their rate of infection? That's number one. Also, what are their sterilization protocols? I really wish I would have asked that. And that could mean also like how they clean their instruments, like what they use for surgery in the operating room. What is their protocol? Like, are they just sterilizing it for a few minutes, an hour, whatever? With Mycobacterium, it actually requires 20 minutes or more of sterilization. Just a little FYI. Now, one that I would have loved to have asked, and I wouldn't have even thought about asking, is, do they use tap water, sterile saline, like during their surgery? That is really important because, again, as I mentioned in my other video, this could be contracted through tap water. So that's really such an important detail because you don't think about that. So hopefully, if you need to have surgery, your doctor will be using sterile saline instead of tap water. So the other one would be if they're board certified. That's a really important one. Another one is if they have experience, like what their credentials are, like how many surgeries have they done prior. Another question you could ask is, what have been rare complications that their patients have had after surgery, and how did they handle them? Now, you deserve a complete full picture of what's going to happen. And obviously there's things that you can expect, that will happen. But if you go in prepared and you ask for these questions, like ask these questions in advance, you will be more empowered. And I think your surgeon will be like, oh, I don't want to mess around with this one because she knows what she's talking about. So it's really important to ask these questions. And they're hard questions and uncomfortable questions to ask, but you're entitled. Now, one thing to also consider is like the post-op. How has your surgeon handled any issues post-operative? Now, have they been, do they have something like in place, like if something goes wrong, like a protocol? And also, can you speak to people that have had surgery with that particular doctor? Not only like see before and after pictures, but actually speak to former clients. So, and do ask to see like the before and after pictures. That's really important as well. If that's depending on what surgery it is, like cosmetic, usually the doctors will have photos. But for non-cosmetic, definitely ask to see if you could speak to anyone, and look for reviews as well online. Now, also, if something was to happen, how does this doctor treat, or what do they typically do? Do they follow up? Like the doctor that I have wanted nothing to do with me. It was so blatant where he's like, oh, good luck. He didn't even say good luck. He's like, follow up with the infectious disease doctor. I would have appreciated a good luck something, but I didn't get that. But in any case, how does that particular surgeon handle any issues that could occur post-op? How do they respond to that? And do they stay kind of with you during the process, or do they just say like, oh, we're just gonna sever all communication and just you're on your own? So those are a few questions to ask. Now, I hope you never have to have surgery, and go into it only if you feel it's very medically necessary. Try, if you can, if you are going to do something cosmetic, where you're really doing your research and asking these questions prior. But if it's something medically necessary, definitely empower yourself before you go under the knife. Okay, so those were my tips for the day, and I wish you all well.